The content within the med-surg Moments podcast represent the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses. This is Alissa.
And this is Chelsea.
Welcome to med-surg Moments, the AMSN podcast.
This podcast is an engaging look at the lives of and surrounding medical surgical nurses.
We're proud med-surg nurses just like you, sharing our stories, insights, and experiences to support you in your nursing journey. All right, welcome to this week's episode of med-surg Moments. Unfortunately, Caroline and Evie could not be here with us, so Chelsea and I are in the driver's seat. What's new with you, Chelsea?
Oh, nothing much.
Are you a millionaire yet?
No. So I'm still doing my trading thing. I do options trading, and then I also do like equity building. So I'm still working on that. I put myself in a bit of a trader's timeout. So I won't be using any of my own capital until December, just trying to perfect my trading strategy. I've been doing my homework and it's been going great. So just taking out some time and learning all that's needed to know about trading. Been keeping my brain occupied and my hands busy.
So trader's timeout means you don't play with your own money anymore?
Right. Yeah, I do paper trading now until I get my technique down.
Okay.
I got an unexpected surprise this week. I'm a huge Star Wars fan, huge Mandalorian fan. I love what Disney Plus is doing with the franchise right now. Mm-hmm. So I got a Protect, Attack, Take Naps mug with Baby Yoda / Grogu on it.
Perfect.
It's so cute. I posted it on my Twitter. I love getting little gifts like that. I'm really finicky when it comes to mugs or things I like. So I don't use it. I don't use my favorite mugs. So I have an office mug too, the world's best boss mug that Michael has in the office that I don't use. So they just sit on my desk and I stare at them while I'm trading or.
Hey, why not? I've got a mug like that I don't use on my desk. Chelsea, I love that your interests are so diversified. You are not locked in the nursing box where you eat, sleep, and drink med-surg nursing. When you clock out, it sounds like you just leave that behind and just go venture into other areas of your life. And that's awesome. That's so healthy.
I know it sounds bad, but when I'm not at the hospital, I am not a nurse. I'm Chelsea, and I like to go by Parker too. So I'm Parker when I'm at home or chilling with my friends. I don't think about work, or at least I try not to. Definitely having a good work-life balance has saved me this year, particularly within the past year with COVID. Mm-hmm. So I guess we'll talk a little bit more about that later in the episode. But enough about me. What's been going on with you, Alissa?
I also focus a lot on a healthy work-life balance. So let's see what's new. For probably, I don't know, my entire marriage, my husband has wanted to get a side-by-side, like a utility off-roading vehicle. So we finally got one, and now we've spent every single weekend since we got it out playing on it, but that's okay. We're having fun. We're going out and we're playing. So it's been a lot of that, going out and having fun and then doing other things at home. We still have this wall under construction that we started in January that I'm really anxious to finish. I don't know. I have this joke with my friends where once you become a homeowner, every project gets done to 80%. So I'm really hoping we don't fall into that. But so far, we are falling into that category, which at least 80% is livable. And then what else? Oh, my son is in driver's ed now. So a lot of driving with him. He's actually a really good driver. So I'm not nearly as scared with him as I was with my oldest. And then COVID, everything is changing with COVID, which is exactly what we're here to talk about today, doing our 1 year later COVID. And I think so much has changed in a year. And as we were talking earlier, just discussing what does the new normal look like and how has COVID impacted our lives and impacted how we will move forward. And one of the things that I realized when I was talking to my friends recently was I think COVID impacted something as simple as making dinner at my house. It became such a chore. I know that sounds silly, but it's I have to feed myself again, every day. And so that became a huge struggle for me. And I wasn't the only one. It's silly things like that, how COVID has altered our lifestyles. So I'm interested to get going on our topic today, evaluating how COVID-19 has impacted our lives and what's gone on in this last year.
Yeah, Alyssa, I totally agree with that. I don't know what it is. Well, I know what it is. It's COVID.
Right.
It's added a weariness to life that I didn't expect for it to. I feel like, especially on Twitter and being in contact with people my age and young people, we're tired. And it's not necessarily from overworking. It's just this weariness that COVID has added. Like you said, something as simple as, oh my gosh, I have to make dinner again.
Every day?
Yeah. Like I can't see my friends. I can't see my family. Layer upon layer of isolation, like having to find new ways to connect to people. I was one of those people that at one point was trying to decrease my screen time. But this past year, like that's how I connect to people is on Twitter or in my investment group via Zoom, via all these apps, talking to people about NBA Top Shot. I created a Twitch account, which I really was never into before NBA Top Shot, but like looking at people's videos about it. So it's definitely added so many layers of weariness and isolation. I just felt for so long, no matter how much exercise I got or how much vitamins I took or how many hiking excursions I went on, I just felt so tired. And it's just kind of COVID just sapping joy out of our lives because, you know, what we usually could do, we couldn't for so long. And so I'm interested to see how I personally will respond to being reintegrated into society and making our way back to, and I say this in quotations, what will that look like? How will I feel about that? Increased socialization. I have a bit of anxiety around that, not seeing people and friends for so long. I find myself texting my friends more often or calling my friends more often just because you lose that physical component. And I think about how many friends I haven't like physically hugged in so long. I was talking to my friend Saida and I was like, wow, like I haven't been to your house since December of 2019. And then my mind keeps going back to that one normal week in March. And then the week after that, it wasn't normal anymore. I think everyone's mental health is suffering right now. And I would definitely encourage people to seek out help, get a therapist. There are lots of cool apps. If I could suggest one called Wobot. So that's WOEBOT. And you can do like mental health check-in, things of that nature. I think we all just need a lot of extra help right now. I think the sentiment is the same around productivity. It's just so hard to get things done sometimes. And it's not even things that are difficult, just simple things.
Like making dinner. I know when I reflect back to a year ago when this very first started, I remember the pandemic being declared and not really having a clear picture of what that meant. This is my first rodeo with a pandemic. I don't have any experience with this. And just as things started changing, right? Restricting visitor policies, throwing up the negative pressure tents outside the emergency room, canceling non-elective surgeries, all those kinds of things in the beginning had this sense of catastrophe. I want to say just the sense of impending doom. And because it just kept going, right? Like we didn't have an end in sight. And here in Utah, we really didn't surge right at the beginning. And so for us, it was waiting for the other shoe to drop. And so I think it heightened that anxiety, right? We had this kind of waiting what's around the corner for us. No matter how in control you feel of your patient load and the surge that's going on, the mental toll on the staff, no matter how many hashtags, hashtag Utah cares, hashtag healthcare heroes, all that kind of stuff. It feels nice to feel supported from the community, but that doesn't really have an impact on the mental health, right? No one's actually in the ICU or the acute care units taking care of these patients and giving that actual help, lending that actual hand, seeing what's happening and helping in that way. And so the exhaustion of taking care of these patients and the mental toll, and then feeling isolated in those units because we try to limit the staff that take care of those patients. We want to have really good clinical staff we train them, we give them the experience, and then we want to keep them there and they don't want to be there because it's exhausting. It's taking a physical toll and a mental toll. Yeah, this last year, it's like nothing I've ever experienced before, which is so silly to say, right? None of us have experienced this before.
I agree. And then you turn around and look and see that the worst did happen. We have 500,000 plus Americans dead here in the US. So how do we reckon with that? We can't just go on like nothing happened. I feel like we all need like a national day of mourning or something to that effect. But yeah, like the worst happened. We failed horribly at the lockdown measures that needed to happen. And now we got the vaccination. For so many people, it's just too late. So what do we do with all of these feelings that we have? That's definitely been challenged. The other thing is, as healthcare workers, we haven't had any compensation. We're putting our lives on the line for the past year.
You didn't get a cookie?
I've got pizza.
Perfect. Coffee, maybe.
But financial compensation, that's a serious conversation that needs to be had on the state and federal level. It's not fair and it's not right. If you care so much about healthcare workers, and I'm not talking about just doctors and nurses. I'm talking about PCAs. I'm talking about the cleaning staff at hospitals. I mean, for the past year, we've all been putting our lives on the line and giving our all to COVID efforts. So what does financial compensation look like? Something that has been on my mind.
Right.
And I get upset when I think about it because I don't want this to be something that gets resolved when I'm 50 years old. I want 40 years from now, when so many of the healthcare workers that are alive and practicing today won't be here 40 years from now. I don't want a reckoning 10 years from now or even 5 years from now. I want this to be at the top of our national agenda.
So one of the ways that I look at this, because I can see, right, both sides of the coin of, oh, we're doing our jobs and it doesn't matter what the patient is, we'll take care of them. That's the nursing way. But the other side of it, from like a tactical standpoint, from a government view, is the war was the virus and the soldiers were the healthcare providers. And so when you look at it that way, normally your government takes care of your warriors and your soldiers. And so when you put them in battle, you're normally taken care of in that way. So yeah, it's a kind of a hard position to be in, because I want to be grateful to my company that's taking care of me throughout this. But it's really frustrating when it feels like a healthcare crisis in our country became politicized, which just created so many barriers. And like you said, so many deaths in our country, and very frustrating from a healthcare standpoint. So one of the things that I've thought about in terms of how the pandemic is going to impact us for the future is that generational theory. I don't know how familiar you are with that, Chelsea, but basically the generation theory states that things that happen to us in the first 10 years of life, things that are impactful, will shape the way that we grow up. For the millennials, that's like the Twin Towers. And my own child was 2, so she doesn't remember that. But how that impacted her is it changed me as a parent, and it changed the world around us in terms of traveling and maneuvering our own world, and the fears and the wars and all that kind of stuff. And so it makes me wonder, now that we have this new generation, I've got friends with little kids, and wearing a mask in public was just something that they were trained to do from toddlerhood, 2 years old, put your mask on, we're going in the store. And it just makes me wonder what the ultimate impact is on this new generation, because this is a huge impact in childhood. It's going to alter the way people parent and the way that we interact with this new generation. And I can't help but wonder, right? The geek in me, the theorist in me, is very curious what the long-term impact is of having us gone through this pandemic.
I agree. Even now, and I'm by no means a child. Well, to my mom, I am. But yeah, I totally agree with that. Even now, I wonder, like within my own personal nursing practice, I think I'm going to wear a mask from now on. And I know that sounds weird, but it's just something that I'm used to now, and it makes sense.
It does.
We come in contact with a lot of people with respiratory issues even before COVID. And so I'm wondering now, is this going to be the new frontier of nursing? Is mask, goggles, gloves? Is that going to be like our new standard practice? And it already is. And I'm wondering how long is that going to last? But even now, I see like myself when I go into the store, I have my mask on. It's just like something automatic that I do now. And then I get in the car after I'm done in the store, And I will ride home all the way with my mask on sometimes because I just don't even notice that it's there. So it'll be interesting, definitely interesting to see how this affects small children, like you said, that within that age group, for sure.
Yeah, it's definitely interesting to me. And I think you're absolutely right in terms of changing nursing practice. I know for my own facility, our statewide mask mandate is scheduled, I guess maybe is the right word, to end in a couple of weeks, but we've already received information from our own facility that we intend to continue. So I don't know how long that will last, but I think you make a very valid point in that this is probably something that's going to continue in our own practice just because it makes us safer, just in general, whether we're fighting COVID or not. It reminds me of those memes that you see about nurses where it's like, MRSA? No, we don't care about MRSA, but bed bugs, like we'll go in head to toe hazmat suit. And I think that attitude has changed just because we can see how quickly a virus can become deadly and how vulnerable we are at the bedside. I think some of the things that COVID-19 has done for the better, so really hard to find the positives in a pandemic, but one of the things that it has done is force people to take stock in their lives and really figure out what's important. At least for me, definitely, it's something where I had to evaluate relationships, right? You're talking about who's your clan, who's in, who's out, who's in my COVID pod, seeing who's bringing that positive or bonus or the good feels to your relationship and who's not contributing to that. Because it's really easy in a pandemic to not see people who are not contributing good, positive energy to your relationship and blame that on a pandemic. Oh, I'm really sorry, we're isolating. But when you have people who are in your inner circle, people who are contributing to your mental health, those are the people that you're going to be like, no, we have to be in a pod. And so I really think that this last year has made people take inventory of their relationships.
Definitely. I think one of the positives or kind of the silver lining in this pandemic is just, it's made me so much more grateful for little things like being able to provide for myself, having family members that can provide for themselves, being able to make a difference in the lives of patients. And just, I don't know, I've taken stock of the things I'm grateful for this past year. I don't take a day. There's not a day that I don't take for granted. I was pretty reflective before the pandemic. But another thing is that I've just gotten to know myself so much more intimately throughout this pandemic. I discovered so many things about myself, and that's been really enjoyable. And that's something that I wasn't expecting. But I definitely feel like personally, I've seen like a lot of personal growth during this pandemic, being able to be
awesome.
Yeah, being able to be more open, like about like my mental health or expressing to people when I'm having a hard time has been really great for me. But yeah.
And I think it's really great for us to listen to you be vulnerable about that because you're not the only one, right? We've all suffered through this pandemic, and having you put a voice to that has been really helpful. Allowing yourself to be vulnerable in this space has been really helpful. So I appreciate that about you over this last year.
It's been nothing short of challenging, but I'm just so grateful to be alive, grateful to be able to use the gifts that I've been given, and just I'm grateful for social media.
Yep.
And Netflix. Shout out to those Netflix original series for giving us,
yep,
for giving us something
services.
to watch, all the streaming services.
Yes. And I think you hit it right on the head. Gratitude. That's probably a better like overall sentiment of what this last year has done. Not just taking stock in your relationships, but finding gratitude in those relationships and gratitude in everything. You're absolutely right. Because I learned real quickly when this started how grateful I was to work in the healthcare industry. And while it was scary to be in healthcare during a pandemic, it gives a sense of purpose for me. I love helping people. I love feeling like I am contributing. And I didn't have to worry about losing my job. I didn't have to worry about being furloughed. And that's something I'm so grateful for. My husband's also in an industry where we didn't have to worry about him losing his job during this process. And so grateful that we weren't impacted in that way. So many other people were, because this last year was so hard economically for so many people. And trying to rebuild their lives after this is going to be a huge challenge for so many people. So one thing that we can definitely be grateful for as med-surg nurses is that demand for our service.
Definitely. I'm also grateful for the Academy of Medical Surgical Nurses. I think that they did, or we, because I am on the AMSN team, I think that we did a great job with reaching out to our fellow med-surg nurses. Just continue to do what you guys are doing, continue to work hard, continue to be grateful, continue to be consistent with your efforts, but most importantly,
Absolutely.
continue to take care of yourself. And if you're not taking care of yourself, please start. Please know that it's never too late to go after what you want, to be ambitious, and to recenter your goals and your dreams, and to recenter yourself. It's a challenge, but you can choose every day to recenter yourself. So that's kind of like my words of encouragement this episode.
I absolutely love that. And I would agree with all of that. And I would just piggyback on with this last year, the year of the nurse, which we made lots of jokes about because it just felt the universe was laughing at us about being the year of the nurse. But honestly, when you look back at it, look at how we shined. Look at how we persevered. Not only were we always the number one trusted profession in the country, but look at how we came into that spotlight and showed them why our nurse is so amazing and so special, why there are so many spotlights on all these different areas of nursing, and how we really fought for the health of our country, of the people who are suffering, and will continue to do because that's what we do. So keep being an amazing med-surg nurse because you are needed and valued and wanted. And with that, we are out of time. Thank you guys so much for joining us. We hope you will join us again on our next episode of med-surg Moments.
Hi guys, have a great week.
We do look forward to connecting with you on our next episode of med-surg Moments, the AMSN podcast. In the meantime, we want to hear from you. Send us your questions, topic ideas, and feedback via our official med-surg Moments email address. That's amsnpod@amsn.org. That's amsnpod@amsn.org.
We'd also like to remind you to become a member of the Academy of Medical Surgical Nurses or review your membership at www.amsn.org. You receive lots of cool benefits and perks such as discounted pricing on the annual convention and continuing education.
We encourage you to help us spread the word and subscribe to the med-surg Moments podcast via your smartphone podcast app to receive notifications of future episodes. Please be sure to leave us a review and recommend med-surg Moments wherever you get your podcasts to help us reach even more listeners.
We invite you to join the conversation by sharing your ideas and questions on AMSN's Facebook, Instagram, LinkedIn, or Twitter pages, and don't forget to add #MedSurgMoments to your post. Simply enter AMSN on the search field of any of these social media platforms to connect with us.
The content within the med-surg Moments podcast represent the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses. Until next time, I'm Alissa.
I'm Chelsea, and always remember, med-surg Moments is a moment in our lives, a moment in our med-surg careers that makes a huge difference.